If you look back into history, what you'll find is that progress has steadily inched along. And this progress continues to this day. This dynamic is still alive, it never stopped. So in this video, I'll share with you how dentistry will evolve and my vision for the future of this industry. So this is a Jade Tooth project, and this channel is one small part of the revolution that's just beginning. We are all active participants in this change, whether we like it or not. And the old systems are starting to crumble. They're bumping up against huge walls. And this is creating ripe conditions for innovation, for paradigm shifts, and for jumping ship from the old destructive ways. Doctors, including dentists and orthodontists, are hurting countless people all around the world. But I don't see this as something to despair about or a sign of the apocalypse. Rather, I think it's a sign that we're on the brink of something really big as a global population. And here's what I think is about to happen. So from a bird's eye view, I think the major shift that's going to occur within dentistry is a shift from harm to healing. And I think this because, well, currently the whole system is rooted in harm, whether it's conscious or not, because the industries that it's based on are also rooted in harm and extraction. But the encouraging thing is that humans tend to have an innate sense of goodness and of wanting to help the people that are in front of them. So I think in most cases it's very automatic and unconscious what's being done by doctors. So with a bit more awareness and consciousness, a lot of things can shift toward the healing that they think they're doing. Right now, toxicity is currently the default. And this is because of the products and the education that dentists are provided with. But if the products and the education change, it just follows that the results will change too. So one encouraging aspect is that these dentists have a lot of tools that they can use for good instead of evil. The same exact tools that they have now can be used differently to achieve healing instead of harm. For example, 5-axle dental mills are currently used to mill zirconia within dentist's office. And this is exactly the tool that's needed to craft nephrite, to craft natural non-toxic dental restorations instead of ones based on toxic metals like aluminum, which are contained in zirconia fillings and implants. CBCT scans are another tool that right now they're being used to better fit toxic materials into people's mouths and to obtain information which is not being responded to in the correct way to maximize healing. They're using the information to act on and justify their destructive habits. But the information that comes from a CBCT scan is really valuable. It can detect infection that can be responded to differently. Bone resorption can be detected and can be treated holistically. You know, essential oils, platelet-rich fibrin, and the like can be utilized instead of drilling in poisons. Also, the precise fitting of non-toxic restorations can be achieved with this. So it's a really important tool, and it's going to be necessary in the future, and a lot of dentists already have these. Drills, dental drills, right now they're being used to drill into people's teeth and their jawbones, and this causes a lot of harm. It's kind of adding insult to injury. More like adding injury to injury, really. So these drills can be used also to take out the toxic things that have been put in. That's what's really encouraging. Instead of putting amalgam and composite and zirconia into people, they can be used to remove these things from people and heal them. So one opportunity that dentists have, and that I think will be increasing in the future, is reclaiming their sacred oath that they take when they complete their training, their education, their Hippocratic oath to do no harm and to act in the best interests of patients. It's not being embodied right now, but it can be. So that's pretty exciting to me. I think at the essence of Western medicine is that Hippocratic oath. That's what founded modern medicine. Hippocrates, he didn't have bad intentions. He wanted to help people, and so do a lot of doctors. But they just don't know what that means, to do no harm. To do no harm means to not put industrial chemicals and toxic metals and petrochemicals in people's mouths. But they think that doing no harm means doing those things, and that's just where something isn't clicking. So to get specific about this, about the changes that dentistry is going to undergo in the future, that our civilization is inherently headed toward, because progress marches on, and this is the trend. Specifically, there's going to be a shift from metals to minerals. Right now, toxic metals are utilized really heavily in dentistry, and the substances that I can see replacing these metals are non-toxic minerals, mineral powders, or carved or engraved stones, gemstones, and crystals, and possibly minerals sourced from certain kiln-fired substances, ash, and There's also going to be a shift from plastics to bioplastics. This is really important because the feedstock of the composite materials that are being used right now is crude oil, and it's being refined in massive chemical plants which don't bear in mind the health of people or ecosystems or the end user of their products. Bioplastics are different. Bioplastics can be produced on a very small scale in a non-toxic way from plant-derived substances which do not cause genotoxicity. And as long as the producers of the bioplastics are not repeating the same chemical patterns that large industry is, then bioplastics have the potential to perform similarly to conventional plastics, if not better, with a much lower risk to the end user. There's also going to be a shift from antibiotics to herbs. Right now, if someone has a really bad infection in their jaw or in a tooth, it's drilled into and they're prescribed antibiotics. The answer for most doctors is just to kill. That's what they know how to do. They're afraid of a life form, so they think they need to murder it. And this doesn't check out with ecology and the principles of natural systems, the very natural systems that created us humans, that allowed our brains to even do what we've done and create the conditions and materials that we have. It's all based in natural systems and ecology at the root of it. So to be aligned with these principles of natural systems, which does not rely on indiscriminate killing, but rather vibrant life, balance and regulation, natural solutions, interaction between different organisms, and intelligent, targeted natural interventions. In nature, there's always something which will come in balance and imbalance. And it just takes patience and trust. And that's where herbs come in. Herbs are nature's biotechnology for our healing, for balancing our systems, for balancing the populations of microbes, for reducing pathogens and parasitic organisms, and for increasing the production and nurturing of the harmonizing microorganisms. So phytochemicals do not produce resistance in pathogenic microorganisms, whereas antibiotics do. We see superbugs being developed by the overprescription of antibiotics, by the overdependence and reliance of antibiotics by the medical industry. And it just doesn't work in the long run. It's a short-term fix that may seem effective on paper, but in practice, it causes more issues downstream, very systemic and long-lasting issues that only herbs can fix and help to redress. There's also going to be a shift from mass production to things being made in-house. So, like I mentioned earlier, large petrochemical plants are producing the materials which are used by modern dentists. There's already this shift starting to happen though, particularly with materials like zirconia. Like I said, there's these dental mills which largely are based in office and can be specially tailored to the individual and made at a small scale with minimal waste. But what's being produced in-house needs to change, and it needs to go even more in this direction for local sourcing of materials and for low-tech methods of producing dental restorations. Because the vast majority of the chemicals and materials used by dentists are still ordered from big industry. There's also going to be a massive shift from offices to healing centers. I think the dental setting in which people's mouths are healed, it's going to change a lot in its appearance. It's not going to look like a workplace or some business-like environment which is filled with white walls, hard corners, and fluorescent lights. Instead, it's going to feel much more like a home, or if you've ever stepped foot into an alternative healing center, I think this is going to be much more common and accurate of a representation of the kind of environment that people can reclaim their health in. Part of healing is feeling comfortable. There's been studies that show that patients in hospitals who have even a view of some nature, of a garden or some trees outside of their window, have drastically higher recovery and survival rates than people who don't. So imagine if the entire structure of the building was optimized for patient comfort and calmness and well-being. It would make a big difference in the outcomes. There's going to be a shift from sterilization to harmonization. Right now, the dental offices and the materials and their tools are all highly sterile, and this requires harsh genotoxic chemicals in order to kill off everything that lives. And what happens when we try to kill off everything that lives is that includes us as humans, as biological organisms, as collections of various microbes. We're actually composed of around 50% foreign organisms. Our bodies are only about 50% human cells, and the rest is other organisms. So by killing off microbes, we're literally killing off our bodies. So harmonization is about creating the right conditions so that pathogens cannot breed in excess. Hospitals are one of the major vectors for diseases. They're actually some of the least healthy environments, the least cleanly environments, although they use all these toxic chemicals. Like I was saying earlier, this breeds superbugs that are resistant to these chemicals. And this is a major problem. People go to the hospital to get better and they end up coming home with something worse than they came with. So there's going to be less of an emphasis on sterilization and more on creating the harmonious conditions for health. There's also going to be a shift from doctors to healers. Instead of university trained and certified doctors who are deeply entrenched in the medical system. We're going to see a lot more certified healers, trained healers, who didn't have to pay hundreds of thousands of dollars to obtain their training and start practicing on people, because there are plenty of people out there who are qualified to do this work, and currently they're not allowed to because of the laws and because of the prohibitive costs of conforming to those laws and standards. Many healers aren't allowed to practice on people in many countries because of this. So I see this as the direction of the future, where qualified, competent healers can be allowed to practice on people, buy their own tools, and start their own small businesses. So now I'm going to talk about the tools that I see being more prevalent in future dental care than they are right now. Some of these tools include ultrasonic plaque removers, using sound waves to clean the teeth, to knock off particles, and pumice stone brushes. This is a type of soft stone, softer than the enamel on our teeth, so it doesn't damage our teeth, and it revolves at a high frequency that will remove buildup on the teeth much better than some modern dental tools. I know this from personal experience because I went to a conventional dentist and they saw buildup on my lower teeth and they said, "Oh, you're not brushing well enough. You need to spend more time brushing your lower teeth and that will solve the issue." Well, I took their recommendation, I tested it for myself, tried brushing more on my lower teeth, and there was no change. But then I went to a biological dentist who used one of these pumice stone brushes and ultrasonic plaque removers and took it right off. All that buildup, which was causing me pain in my mouth for years. Other tools include biofloss, bioplastic floss, which does not leach microplastics into the mouth like conventional floss does and is much gentler on the gums. It's really helped me, bioplastic floss. It's encouraged me to floss a lot more because it doesn't hurt, it doesn't make me bleed, it's a lot more enjoyable, and I feel better about it. Also, I know when I throw away the floss that it will just degrade very quickly into the earth and not cause pollution downstream. Same thing with boar bristle toothbrushes, whether they're manual or electric. Bamboo and boar bristle together, it's a really great material for toothbrushes. I think bioplastic toothbrushes could also be prevalent and useful in the future. Bioplastic scraping picks as well, instead of the metal scraping picks that are used, which I think are much rougher on the teeth and gums. Different materials that will be prevalent in future dentistry include nephrite, as I've talked about a lot on this channel, mineral-based cement, as I've also mentioned, bioplastic clips and bodies for things like flippers, retainers, braces, expanders, clear aligner systems, and I think these bioplastics can be reinforced with crystallized herbal extracts from ultrasonic extraction so that they don't really contain foreign proteins other than the targeted phytochemicals, which can help to reduce bacterial contamination and preserve the lifespan of the bioplastics greatly. Herbal toothpastes and herbal treatments in the mouth, I think, will also become much more prevalent in dentistry instead of things like chemical toothpastes and fluoride treatments. So that's it for the specifics of future dentistry, and now I'm going to get more into the human aspect and the value shifts that will occur. So the first being sovereignty. Right now there's a huge issue with people's sovereignty being invaded and crossed in modern dentistry. Right now it largely operates on a trust me mentality instead of informed consent. Dentists tend to do what they think is best, and a lot of times they don't even consult the patient on what they're going to do to them before they just do it. I've heard many horror stories like this, and it's happened to me too. Informed consent is explaining the desired procedure, the intended techniques that would be performed to the patient before performing them, asking if the patient agrees or is comfortable with these techniques, also informing them of the risks and any alternatives that exist. This is up to the dentist. This is the responsibility of the doctor, not the patient. Childhood education and adult education, I think, will also become very prevalent in dentistry. Right now, the dentist is the one who's being educated through many years of school, and then they think that they know better than the patient. But this wouldn't be the case if the people who received their formal training were actually helping the patients, no matter their age or cognitive ability, to understand for themselves the specifics of the procedures and the techniques that are used and the rationale behind them. Preventative care instead of reactive care will become a lot more prevalent. Right now, people come into dentist's office with huge issues, and the dentists react and try to solve the huge issues with extreme measures, and this ends up causing more damage. It would be a lot better if people didn't have these issues in the first place, if from the time that they were young, they were, once again, educated about how they can provide their own dental care and what kind of things will avoid cavity formation and other dental issues in the first place. For example, not eating white sugar. This is a very basic step that can be taken. Cutting down on simple and particularly refined carbohydrates can make a big difference. Patients will be sent home with the same tools that are used in the office. Right now, dentists, they send little baggies home with people. Usually they contain a roll of plastic floss, a plastic toothbrush, and some toothpaste. Maybe a propaganda educational pamphlet in there too. But this goodie bag, the contents of this goodie bag are going to shift dramatically so that the tools and the materials that the dentists are using are made available for people to use at home so that they are not reliant on the dentists anymore. But dentists have vested interests in people's reliance on them. They want their customers to keep coming back so they can continue profiting off of them. So they don't share the tools that they use with their patients. They don't gift these to them. And this is probably for the better in modern dentistry because the tools that they use actually do have a lot of harmful potential. But if safer and less invasive tools were used, then people could be sent home with them, at least most of them, so that they can take their healing into their own hands and reclaim more sovereignty. There's going to be an increased ability for people to choose to deny specific care without totally losing support in other ways. Right now, patients do have a legal right, at least in the US, to deny medical care should they choose. But a lot of times, if they exercise this right, then the dentist will basically abandon them and say, okay, you don't want my help, I won't give it to you. But if someone denies an aspect of care, then it's just for them to be able to receive other care, other types of care from the same practitioner, so they don't have to keep bouncing from dentist to dentist and trying to find someone who doesn't want to hurt them. So we'll start to see things like more appropriate responses to the denial and rejection of certain practices, more mature responses. As I mentioned earlier, it's going to become more prevalent that patients are explained every risk that there is to every single intervention and little thing that dentists will do before it's done, not for them to find out with their own research later, or to find out the hard way. Though in future dentistry, with safer tools and materials, risks will be greatly reduced anyways, so there will be less to explain. There's going to be less pressure tactics and misinformation in dentistry because it's going to become more decentralized, less profit-driven, and the intentions of dentists will change, like I said, from harm to healing. Right now, dentists think they know best in a lot of cases, and because of this, they put a neurotic pressure on people that they agree to what the dentist thinks is best. This is classic manipulation and coercion. We're going to see a shift from generalists to specialists. Sorry, other way around. We're going to see a shift from specialists to generalists. Right now, there's hyper-specialization and lots of referrals, again, bouncing from dentist to dentist or specialist to specialist. And this wastes a lot of people's time and money. And people who are more equipped in broad areas and can help people with whatever issues they're dealing with, it's going to make the patient care a lot more smooth and enjoyable and safe for people and affordable. Which brings me to affordability. So dental care in the future will be government subsidized. Right now, a lot of people are left hanging because it has to come out of pocket or be covered by insurance that they pay for themselves. Only in the most progressive countries on earth right now is dental care fully covered by the government for all of its citizens or even non-citizens residing in those countries. There will be no cost to the lowest tax bracket. This should be standard and will be standard in the future, that people who can barely afford to pay for food and housing for themselves will not have to pay anything for their dental care, for the same standard of care as people with a lot of money receive. There will be free consultations in the future, not ludicrous entry fees. There will be treatments at cost or near to cost, so that people aren't being taken advantage of and having price hikes and that sort of thing. But whatever it costs the dentist to use the materials and tools that they do, that is close to what the patient will be paying, if anything. There will be also an increase in the use of sliding scales so that people can determine what they can afford to pay rather than the dentist telling them what they need to in order to be healed. Same thing with donation-based systems, that people are just asked to support the practice and the healer if they can, however much they want to or feel like they can afford to. This takes the pressure and inaccessibility out of the situation. There will be no multimillionaire dentists. This will be a thing of the past. Right now, dentistry is seen as a great, promising profession to go into financially, because most dentists do make multiple millions of dollars. They end up usually spending it on themselves, on their large homes, yachts, cars, clothes, watches, and the like. There will be no predatory medical loans or anything like this. The insurance companies will be cut out of the equation. Co-pays and premiums will be a thing of the past as well. It'll be people first dentistry, not money first dentistry. Regenerative techniques will become much more prevalent and relied upon in the future. Things like platelet-rich fibrin, which uses patients' own blood to extract platelets and put this back into their jaws, so that basically it decreases the rejection rate of regenerative treatments, so that people's bones can regrow themselves without putting any foreign substances to their body and inside of them. It has been proven very effective. It's a very modern alternative technique that I think has a lot of utility and potential. Things like deer antler velvet extract will become more standard in people's dental care routines, because this extract contains stem cells specifically designed to generate bone. Comfrey root infused olive oil has allantoin, which is a phytochemical which basically spurs the generation of differentiation of new cells. It basically basically increases our body's ability to regenerate any tissue which has been damaged. Diet prescriptions and mineral teas, high mineral teas, will become much more common, so that, once again, is a form of preventive medicine, so that people aren't getting into the situations that they're in with their health in the first place. Essential oils will become much more common in the dentist's office, such as peppermint oil, tea tree, clove, cinnamon, thyme, myrrh, eucalyptus, and spearmint. These are all great essential oils for the teeth. The promotion of sourcing organic will become very common because pesticide-laced substances are not good for our tissues and can degrade the mineral matrix of our bones and teeth. And just in terms of supporting our immune systems, protecting ourselves, and increasing our overall health so we can be more resilient to certain conditions. Herbal numbing will become more prevalent, especially for minor procedures, and I will share a whole lot more details on this in the next video, because I have developed products and techniques for this and used it on myself. My fiance has used it when we've had a dental procedure, so stay tuned for that video. And finally, compassion and personal care is going to be the cornerstone of dentistry. Right now, there's a lot of in and out, pushing patients through the office, having strict time frames and schedules that they can be treated within. This totally destroys personalized care and being seen as a patient for the actual issues that are prevalent and the root causes which are causing them. Dentists will be able to take their time in the future with their patients and take as much time as they need to fully address the problem and see the patient for what they're going through. Receptionists will be kinder, and this will be a function of also the care that the receptionists are getting. Right now, a lot of receptionists in dental offices are receiving the same dental treatments that are being provided to the patients. So of course, they're going to be rude and ungrateful, impatient, and unpleasant because they're suffering with toxicity and pain themselves from what their workplace has done to them. Constitutional assessments, looking at people's individual biologies, patterns, and backgrounds and conditions, will become a lot more common on intake into the office. This will allow for a lot more specialized care, because what may help one person could be useless to another based on their individual constitution. And finally, people will feel in less pain than they came into the office with. This is really the whole goal of dentistry. Right now, people may feel temporary relief if they're lucky when they leave a dental office, but a lot of times the problem is made worse and they have to keep seeking treatment over and over, and their pain is not really reduced at all. So this is my vision for the future of dental care. I think this is where we're inevitably headed as a global species. 100 or 200 years from now, I imagine a lot of these things will be standard and in place, even though right now they sound far-fetched and idealistic. that's how it works. As time marches on and progress continues little by little. So, if you received value from this video, please help to support this channel by liking and subscribing, sharing this video with anyone who you think may benefit from it. Watch the other videos on this channel to receive more of a background of the concepts that I'm talking about. And if you're interested in joining me, joining my team, please do. Please reach out, whether through the comments or through my email attached to this YouTube channel, so that we can co-create this new future together, so that we can develop new dental restoration materials. My goal for this channel is to develop a novel, non-toxic flipper, inlays, and fillings out of nephrite jade, mineral-based dental cement, and bioplastic. So if you're interested in helping me, I would really appreciate the support. Any words of encouragement are also appreciated. Please leave that in the comments down below. And if you are a rebel dentist or anyone interested in this topic remotely, want to further the advancement of this field and help people's health, if you know anything about CT scans and their interpretation, or if you have access to dental mills, 5-axle dental mills, or CNC engravers for gemstone cutting, then I'd be very interested to connect for the development of these new dental restorations. If you're a patent clerk or a lawyer, I'm also interested in connecting for creating a defensive publication for these new technologies, so that they can be freely accessible to everyone and affordable, and never privatized, never corrupted or co-opted or modified in harmful ways for industrial benefit, so that it can be democratized and decentralized. So, thank you for your time, and stay tuned for more.